Thank you. Look, Minister, my first question is in relation to emergency department waits, and I'm looking for an outline in terms of the length of time that people are waiting, if the targets that have been set by government are actually being met in terms of the maximum wait times. But also just very quickly to say to you, Minister, that in a PQ response that I got back yesterday, the average time to admission for over 75s in emergency departments across the state was 13.75 hours. That's a long time, and unfortunately the data right across the board isn't good.
Thank you, Deputy. It is too long. It's completely unacceptable. I've seen personally, and no doubt you have too, the distress in the overcrowded emergency departments, distress to patients, distress to their families, and distress to our own healthcare professionals right across the country. I visited some of the busiest sites. I've been in places like Limerick and Galway. Later today I'll be in the Mercy, and tomorrow I'll be in CUH, and I'll be talking to the senior management and clinicians about what's going on, what needs to change. We invested about 1.1 billion extra in the budget for last year to expand capacity, services, reform, and we maintained this through this year and added an additional 77 million into the winter plan for the winter that's just gone by. The plan sought to address the causes of the long waits in the emergency departments. It targeted attendances, patient flow, and better egress or discharge. The approach is to allow the emergency department staff focus on those most urgently in need of care, or most in need of urgent care. We've provided an extra 850 additional non-ICU hospital beds since January of 2020. Now, despite the unprecedented investment and increase in capacity, patients still face unacceptably long waiting lists. I want to make that very clear. What patients are facing, not in all, but in some of our hospitals in emergency departments, is simply not acceptable. It's mainly due to increased attendances, increased admission, especially to for those over 75, to the PQ response that you received. Many are sicker than before. They have comorbidities. The average length of stay is longer. And COVID, as the Deputy will be aware, has impacted on bed availability and facilities within the hospitals. It's also, unfortunately, affected in a very significant way discharge options, including taking out about 2/3 of the nursing homes in terms of being able to discharge patients to them.
Minister, one of the hospitals that you raised that you will visit tomorrow, Cork University Hospital, Waterford, the average wait time for over 75s in the month of April in that hospital was 28.8 hours. Over 24 hours. I find that absolutely staggering for the entire month. And these are people over the age of 75 who you admit have comorbidity difficulties and challenges. The same with Mercy University Hospital, Waterford. The average wait time 26.8 hours. University Hospital Limerick 22.2 hours. So we have major problems right across all of our acute hospitals. And you're right in saying some hospitals are getting it right. I will get to the solutions in my next round of questions. The Our Lady of Lourdes Hospital in Drogheda, as an example, and also Cavan Hospital are two examples of hospitals that have put in place a zero-tolerance approach to emergency department waits, and it seems to be working. Why is this not being replicated across the state?
Thanks, Deputy. Can I fully agree that the operation in Our Lady of Lourdes and Drogheda is fantastic. I think they have 5 separate pathways when you come in, including the use of advanced nurse practitioners who are doing a phenomenal job in terms of being able to handle, see, treat, discharge. I think about 70 to 75% of the patients who are coming in to Drogheda. It's fantastic. And exactly the challenge you've posed is exactly the challenge I posed to the HSE. So what are we doing about it? There's a group in place now that is looking at every emergency department around the country and doing an analysis of what they have and what they don't have versus what they must have. They're using an approach, it's called the 5 fundamentals. They've pulled it from experience in Scotland, experience across the UK. But essentially what it comes down to is looking at pre-admission, reducing the numbers coming in, whilst in hospital making sure they have the facilities and the management that they need, and then thirdly, that patients can be discharged. So we're putting an analysis together at the moment for every emergency department, and I'm determined that the identified gaps will be met.
First of all, Minister, can I say that we obviously need more inpatient beds in some hospitals, but it isn't all about beds. And actually some hospitals that got additional beds in recent years, we're not seeing the improvements that we need. So yes, there are some hospitals, of course we need more inpatient bed capacity, because if you have more beds you can admit patients more quickly. We also need a discharge plan for each patient as soon as they go into the hospital, and that needs to be multidisciplinary, all staff working together as a team. But they also need to know that the step-down beds are in the community, which very often isn't the case. Many patients can't get home care support packages. There's a clear linkage between what's happening in our acute hospitals and a lack of capacity in GP care. I've raised this with you before, out-of-hours care. So unless we get the enhanced community care piece right, we're going to continue with about 40% of patients going to emergency departments who should be treated in the home or in the community. And I think that's, Minister, where your focus needs to be. Thank you.
Minister, to conclude.
Thanks, Deputy. So I would agree with all of that. And in fact, in Bray on Friday, I met with the new chronic disease management team, the new older persons team, and the new community healthcare network, including a pilot on mental health led by an advanced nurse practitioner in mental health. And the level of prevention that is going on, including emergency presentation, is very impressive. It's fully in line with the Sláinte Care vision, which is a massive investment in community-based care, and we are beginning to see a reduction in referrals in the areas where that has been deployed. And could I say, Deputy, certainly there's no monopoly in wisdom in terms of fixing this issue. If yourself, other colleagues, or indeed the Health Committee wanted to meet or wanted to put in a submission, I think that would be very welcome, because we're in the middle of a very intensive planning phase at the moment with the HSC. And as I was saying earlier on, what I've asked the HSC to do together with the department is go hospital by hospital, because the solutions are different by hospital. So any insight or ideas the committee may have, or indeed colleagues may have, would be very welcome as part of that planning work.